Hi, I'm Dr. Mark Jeffery. I'm the director at Ulala Cosmetic and Laser. We're a multi-dimensional cosmetic and skin clinic as well as skin cancer clinic. Today, I'm going to be doing a high-energy Neogen Plasma treatment on our patient, and I will be combining that with some platelet-rich plasma. Our patient has quite significant glycation in her skin. We can see that here. Basically, the skin's a bit hydrated now because we've put topical numbing on. So I'm going to use a high energy treatment today with the device. It's a nitrogen gas plasma, so the nitrogen goes over an excited high frequency coil and generates nitrogen plasma. So we're going to do a pan-facial treatment. So I'll be treating the forehead, the upper eyelid, and the lower eyelid. The benefits of the eye treatment is in many ways it's a non-surgical blepharoplasty. It's a highly effective treatment for skin tightening, and dare I say that the treatments being offered at the moment for non-surgical eye lifting, generally if you're using fibroblast treatments or radio frequency, require 4 treatments. It's very costly. It would be more costly than the cost of this treatment. So we're going to do the nose resurfacing, we're going to improve the glycation through here, we're going to do the upper lip lines, and we're going to do the jawline and chin. And what we'll see as well is that a lot of this kind of loose, saggy skin will tighten up and give a type of facelift result. So it's an excellent treatment if you're looking for pan-facial rejuvenation. The downtime on high energy is about 5 days, but when I say downtime, I don't believe it's as aggressive as some really strong chemical peels that we do. So I've numbed her up. I've done some peripheral nerve blocks in her face as well. She's nice and relaxed and calm from her pre-med, and I'm going to start the treatment. Okay. I'm going to roll the head a bit to the side. Alright, okay, so I'm going to start first in this area because this is the area that I want to focus on a bit more intensively, and you'll see that it's a pretty quick treatment that compared to say doing a laser. If I did my U laser treatment, which is a CO2 1540 laser, very similar to Fraxel, I could be here for at least an hour or longer. This is much quicker.
Ready.
So what I want to do is just increase the frequency of the shot. So we'll go to 1.5 or 2. We'll treat. And I'm going to work my way down in this direction. When I come to do the eyes, I'll be doing a little bit more protection of the eyes as well. Okay, so I'm going to start the treatment. We're ready to roll. Okay. And this really is all the treatment that is required. It is a bit hot for the patient. Yes, it does sting a bit, but it's certainly not, if I was using a very strong laser, it would be intolerable. The beauty of this treatment is once we've completed the treatment, we can infuse solutions into the face and it penetrates because of the plasma, so you get that advantage as well. is the area where she had the most glycation. So I'm just doing that now. And then I'll come across, I tend to do these in sectors. Now what we'll do is we'll come across and do the top upper lip. The upper lip, as you know, is a tricky area, and there's different ways that I treat the upper lip for clients, but because we're doing a pan-facial treatment of this area, yeah, it's just a bit hot. It's important that you try and not overlap too much. The highest energy setting is about 3.5 on the face. I don't tend to go to 4 joules. And I'm just going to do the nose while we're here. And I've almost done half a face. That's why I really like this. It's really not a stressful device to use, and this is a bit tender because I haven't injected there. Now I'm going to do a high energy treatment through the forehead here as well, and then I'm going to go down to a lower energy treatment. I'll do her eyes as well, which I'll show you. Now she is going to look fantastic after this procedure. Okay. You can see some of the carbonization of the skin as well on here. And now I'm going to crosshatch. I'll crosshatch as you can see, it's really not a stressful treatment to do, and your staff, your trained therapists can do the treatment under your supervision. Whereas with CO2 laser, you can't really do that. You have to have a doctor. So we're just going to come up here where the eyes are, just overlap. No, you're good. And what you see with this as well is you see tremendous tightening in the skin. And this tightening that you get from the Neogen Plasma happens over several months. And like most things in aesthetic medicine, we often do combination treatments. So depending on where we get to with the skin, we may go on to do other treatments. And as you know, this might include fillers, threads, collagen threads. Continue with platelet-rich plasma, fat transfer. You know, I always like to remind patients that they really need to kind of, you know, put away a little bit each month towards their care. And the reason I say that is that if you're blessed not to get a serious illness in life, modern medicine is going to keep us alive for a very long time. Seeing here, I'm going to come under the jawline here, just to put your hands down, love. Can you, no procedure, whether you're doing a high intensity laser, is completely painless, okay? There's enormous heat that's generated through the plasma at the tip. Okay, so I'll come over the forehead now, and we'll just start here and keep going around to there. I'll just keep going all the way over to the other side so I don't have to come back. I'm just cross-hatching here. Now this is pretty quick going, and there's no issues with the laser lights to your eyes, so on and so forth. I think what we'll do is we'll come back here to the lower eyelid shortly as well. Okay, so I've basically just got this area over here to do. Very quick treatment, and I don't know of any device really where you will get the results of that I anticipate with this treatment that can be done in a short period of time, mainly topically done, with a bit of carbonization of the skin, some later onset peeling, which I have to say is very good. People get quite concerned, or am I going to peel, am I going to have downtime? Like I said, we have to retain our youthfulness for many years ahead to come now. People are going to live longer, the workforce is more demanding, people are engaged in social media and more relationships as we get older. It's important that having your face as your gift to the world, I know it may seem a little bit corny, but that is the reality, and we need to invest in that. We have such great treatments available now that we can wind back the signs of aging. But it requires a commitment from the patient. It requires an understanding that these are strong treatments. These are not cheap machines. They're highly technical, and we are using the fourth state of matter in this machine called plasma. Not fibroblasting, that's completely different. Okay? And it is the best way of rejuvenating someone at the moment with the least amount of effort to get the best possible results. So I'm going to start now. I've re-moisturized the side of her face, and we are going to get going. So we'll start again here. You can see the deep lines that the patient gets if I just move her skin. You can see this is what we call glycation, okay? This is loss of collagen and elastin. Now, why I like this machine is that what I've tended to find is that when I do lasers, the results are good initially, but particularly around the eyes. As time goes by, one tends to see more thinning of the actual skin itself. And given the fact that eyelid skin is the thinnest skin in the body, you don't really want this. So the opposite is Neogen. Does not do that. Neogen actually strengthens the skin and increases the thickness of the skin. And that makes it particularly appealing when you're doing the eye area. When we come down here to the preauricular area, we'll get some tightening. And this is a very mobile, semi-mobile area. As you can see, in her there's loose skin. Put your hands down, love. So she's not completely anesthetized with the skin, but there will be a few areas that we may have missed. But it's such a quick treatment that it's very seldom necessary. Now, we don't use cooling devices on the face, unlike laser. But she's going pretty good now, and it won't be long, and I would have completed the the left side of the face. It just goes through duty cycles, so it delivers a certain number of shots and then it recalibrates itself. This is just hot. At 3 joules it is hot. Put your hands down, please, love. Okay, but like I say, it's such a quick treatment that if anyone's ever had a strong TCA peel, they'll know that the skin can get quite hot. So we'll just come through here. So what I'm going to do is I'm just going to come now and do the top eyelid again. Stay still. Open it, just stay still. Right, we've just finished the treatment. As you can see, there's a bit of redness now in the face, and we'll put on a mask that's supplied by the company just to ensure that we maintain the hydration of the skin afterwards. So in summary, Neogen Plasma involves a gas delivered through this tube that goes over an excited high-frequency device inside the handpiece, and this creates a nitrogen plasma, which is a fourth state of matter. It allows it to penetrate the skin. As you can see, unlike laser where we're punching lots of little holes into the skin with light energy, there is no break in the skin that is directly visible with the plasma, and that's why it's a fourth state of matter. It's able to penetrate the skin by being in a plasma state of energy, and that energy is able to be transferred into the skin itself to start the rejuvenation process. So if you would like any further information, please don't hesitate to contact Ulala Cosmetic and Laser. This treatment took approximately 40 minutes and she'll be going home shortly, and then we'll see her for follow-up in the clinic, and by day 7 she's going to have the start of new skin forming. The repairing process of skin naturally will take hold, and the effect of the plasma to stimulate fibroblasts and stimulate collagen elastin will begin, and we expect to see a great result in 3 months for the full effect. And the skin tightening that you get from this Neogen Plasma can last up to 2 years, which is excellent. There's not a device on the market that can do that. Once again, thanks for your time. If you need any further information, please don't hesitate to contact myself, Dr. Mark Jeffery at Ulala Cosmetic and Laser, or contact our staff at reception or dermal therapists who can give you more information. Thank you.